Once you're satisfied with your rich picture, you need to move on to step 2, which is identifying the key variables. Look at your rich picture and list all the variables that you can identify that are key to this situation. Remember to note that a variable is defined as an element in a situation that may act or be acted upon. It is not an event. When naming your variables, you need to ensure that they are nouns, not verbs, that they're measurable or observable, that the value can vary up or down over time. So you could talk about the level of quality of care, the number of patients utilizing the health service, the quantity of drugs and supplies available at the services. Try and keep your variable neutral. So you should not be talking about poor job satisfaction or demotivation. You're talking about simply staff motivation or job satisfaction. Use the positive sense of the variable. So using motivation as an example, you talk about motivation, not demotivation. And the reason for that is once you start thinking about whether this particular variable increases or decreases, it's hard to start thinking of all the negatives. So increasing demotivation is very difficult to understand what that means. And where appropriate, distinguish between perceived and actual states. So there's a big difference between actual quality of care provided and the perceived quality of care provided. Both may be equally important within the system, but they may be acted upon or act on other variables in different ways. Once you've listed out all your variables, take a look at them and see if there are any of these variables that can be grouped together. For example, in this situation, I would argue that perhaps workload and overcrowding could be grouped together. Staff remuneration and staff incentives in this context should be grouped together. And in this particular context, individual user fees and out-of-pocket payment are two variables that could be grouped together in this context. When you have your final set of variables, it's really important to look at each variable and make sure that you understand what is the construct, what is the thinking behind that variable. So for example, let's take this variable user fees and out-of-pocket payment. What do we mean here? Well, in this context, we're talking about money that people have to pay in order to use services, be they public or private, but they're paying for them out of their own pocket. So it's the money that people pay for in user fees and the money that people are paying in out-of-pocket payments. Similarly, in this context, when we talk about staff remuneration, we're talking about all money and incentives that staff receive for work done. These might be money, but then in this context, we're also talking about non-monetary incentives. So a good practice is to look at your variables and write out the definition of each variable, because this will become very important when you're developing your interrelationship diagram and your systems map.